how does Dad get his needs met during this?
The evidence is he puts himself on hold, and that causes problems. And it causes problems for his own physiology. It causes problems for his fuse being too short. These are with wonderful spouse partners. This is true of happily adjusted marriages or ones that are a little bit dealing with some issues before even the breast cancer. This is normative for all couples. So he gives it away. He gives his self-care away. And he doesn't talk about it as self-care. That's a word that's a woman word. Taking time out for himself is how he would think of it. That's what he gives away.
So going to happy hour and going to the gym, those are the types of things that
he gives them away. He gives them away. It's not good. It's not good.
So Dad still has to make time
He has
for Dad.
to, 10 to 15 minutes a day. I would prescribe it if he was in my practice, but the bottom line is our studies show us he needs that.
What about dads that don't know how to help? Yeah, I hear a lot of men say, I wish I could have done more, I wish I could have been there, I don't know what to do to help her, I don't know what to do to help the kids. Do you have tangible suggestions of what Dad can do to
help the children and the mom?
Yes.
So my first thing as I go thinking about it, based on evidence, is you can't tell somebody what to do based on their particular dance. So what you do, and I want to go back to this idea again, is he identifies within the time he has available, so he doesn't kill himself doing yet more things, what he and the children together can figure out to have quality time. And it becomes a family discussion, even 2 to 3-year-olds. And it becomes a positive discussion. It's not framed as, mom's not herself, she's going to be sick for 12 months. It becomes, as mommy gets better, as mommy goes through the medicine, as your mom starts to become herself and feel better, what can we do? He's talking to the children, and maybe it's one-on-one with the child, depending on their dance, or it's a small gathering. He takes them out to a place, a park, a fast food, quiet place in a corner with milkshakes. I don't care what it is, whatever they do, but bring them together. It's a moment, it's a time to create a new, the way we think about it is give away what was and focus on what you have now, because today's a new day and we're going to be a family. Everybody thinks the whole focus should be only on the patient, and the family is treated with benign neglect, and nobody's a bad guy, because the mommy is in survival mode, which is exactly what we want for her to heal. But in the meantime, all this other thing is going on. So to put balance back, family, kitchen table discussion, what can we do? Let's figure out what's important and how Dad can, or maybe it can't always do it, but let's figure it out. And part of that discussion is what you can give away. And families have a hard time giving away, and I don't mean money, but for example, some dads really are driven that they have to water the lawn, or they have to wash the car, or they have to mow the lawn, or they have to clean the house, or they have to have the dishes done every night, because that was before when she was well and there was 2 of them. So part of it is giving away what's not important, but not one person deciding. Make it a family decision. And it's notice that there's not a burdening, it's a relinquishing, so you have space to be a family.
So it's that concept of almost redefining the new normal. I know
Exactly.
When I was going through
Exactly.
it, we ordered lots of Chinese food. The house wasn't nearly as perfect as I liked it to be, but you had to kind of redefine.
Yes, and a lot of families who don't do what you've done or did what you did, I get referrals in practice with couples who are so angry at each other, who are so exhausted, and she's doing well with her breast cancer, and it's because they didn't relinquish what wasn't important. They kept expecting each other to do everything. They wouldn't let go of what wasn't important. And the children, they read that tension. If that is not worked out, what happens is families start to define themselves as being full of tension. And the children and the husbands and the diagnosed wife starts to deal with the tension in the household rather than working through to the healing phase in the cancer.